Doctor-patient relationships and how they have evolved by Harquita Wallace. Chapter 1 is the problem statement. When did it first appear? First half of the 20th century. The doctor-patient relationships have transitioned over the last decades, and the relationship was basically set up for the patients to comply with the doctors and have very little or no say-so at all about their health. The doctors would basically use their expertise to choose whatever treatments that were most likely to help the patient's health be restored based solely upon his or her decisions. The current scope, significance of the problem. The importance of doctor-patient relationships is that they allow the patient the right to have the say-so in their own health care. What is currently being done is the doctor as well as the patients have adopted these changes and are both doing their part to accept these changes as they have been mandatory and implemented by healthcare professionals across the United States, and there is no way to revert back to the previous doctor-patient relationships. Also, patients have become advocates of their own health. What role does management play in context of the issue? Managers diversify the workplace. They find creative ways to implement changes. They also implement a merit system to rate their employees. Responsibility of the doctor-patient relationships. The healthcare board currently owns this problem as they have voted to cut costs and have the medical professionals to stay within a certain budget to ensure that the healthcare costs are cost-effective. The problem does not remain unaddressed, and it persists today because of the advancements within the healthcare system, and patients are being properly educated and also made to feel as though they are a huge part of their own healthcare that they receive. Is it related to cost, access, or quality, or a combination or all? This problem is cost-related as it provides the insurance companies with the ability to get payments for physicians in which the attending physicians are spending less time with their patients, thus also seeing another staff member such as a nurse practitioner or physician assistant, and sometimes teams of doctors in ER settings. Chapter 2, Literature Review, Theoretical Framework, Doctor-patient relationships and the evolvement known facts. It can foster doctor-patient communication, which has a significant impact on health. It helps the patient to have more autonomy. The patient has the authority to say whether they would like to receive care in the first place. It also lessens the time physicians spend with their patients. What the future would be to have doctor-patient relationships to revert back to what it once was. The doctor-patient relationships could never go back to how they were as the advancements were made to cut costs and to improve the budgets set by medical boards, who in turn voted to make these changes. Chapter 3, Strategic Plan. Who will benefit? The organization itself benefits when human resource managers hire individuals with like-minded ideas. Leadership, there must be good leadership, and managers must know when to differentiate effective management and effective leadership. Patients must be well informed of their conditions and voice any concerns or questions that they have during their visits. Providers, ACA or Affordable Care Act raises the question, will insurance companies remove PCPs from their panels, which will force patients to change doctors? What will the healthcare environment look like once the problem is solved? There has been several concerns that the physicians are spending a lot less time at their visits, especially ER visits where there are teams of doctors, and primary care visits, in which doctors can be replaced by other healthcare workers who are just as qualified. The healthcare environment will cause patients to have successfully gained a positive outlook and have positive outcomes or experiences and feel good about the changes that have been made due to managers and insurance providers implementing these changes for physicians to cut costs as requested by the medical boards. The organization as a whole will thrive as doctors and patients' relationships are more effective and more efficient. Chapters 4 and 5, Recommendations for Future Study, Limitations. Possible barriers for implementation include social barriers as well as political barriers. There are social barriers such as the limitations in which the physicians do not have the usual time to spend with their patients, in which socialization is lessened. The political barriers are devised by medical boards, which makes this a problem in the first place, as the doctor-patient relationships evolved and mandatory changes were implemented, making the patient take on more of an autonomous role and the doctor role lessen. Limitations of the plan and costs are also associated in this chapter. There are some limitations of the plan in which it is not effective if the doctor and patient are not both participating. Doctors should listen to their patients, and patients are responsible for asking questions during their doctor appointments. In addition to physicians' salaries, there is also overhead costs in which the managers of the healthcare facilities must remain within budget. And this is also why the medical boards have implemented these changes to have other healthcare workers to work in place of some of the primary care visits, physicians, and also to assist in ER visits. Conclusion. Overall, doctor-patient relationships have been lessened over the years, and the patients have more autonomy during their visits and have been given more responsibility to have certain information about their visits readily accessible, as they are oftentimes referred out to other physicians who are specialists or are seen by other healthcare employees other than their regular attending physicians. This can be a burden by some patients, such as the elderly, as some of them are independent and many of them do not have family members to help care for them. As the problem persists today, although it is the patient's responsibility to have more information ready for their physicians must also be able to provide them with the best care possible. Medical boards oversee physicians and they appoint managers who are responsible for having primary care physicians to make necessary changes and cut costs for their budgets. Although physician's income is what he or she takes home in payments minus expenses or overhead, they have to deal with the insurance bureaucracy, which ultimately reduces the amount of time a patient has with their doctor. Labor and technology are also aspects of the doctor-patient relationship. And as labor of physicians do not require specialized training, this is because the majority of the healthcare providers that replace the physicians are equally trained. Also, modern technology is digital now and has done away with the old paper system, but it still has some problems such as the incorrect data input by either the physician or insurance providers. The social barriers that exist between physicians and patients can be lessened if physicians are more attentive to their patients and if patients take on more initiative to educate themselves about the existing conditions and come to their appointments prepared to voice their concerns about the problems that they are having for not only their primary care physicians, but also any other physicians that they are to see for other appointments. such as medical specialists. The scope of the problem will not change, as it was made mandatory that the doctor and patients alike comply with the changes due to budget cuts for health care. The costs do not directly affect the physician's salaries. However, it has caused the relationship of the doctor to be lessened, and as a result, the patient to have more of an autonomous role.